Afternoon. I think we'll go ahead and get started. Thank you for joining me here today. 7 months ago, Sioux Falls experienced its first positive case of COVID-19. Since then, our community, as well with others in the nation and across the globe, have faced challenges in how to best fight not only the virus, but also the far-reaching implications of the virus and its effects on mental health, healthcare industry, economic vitality, business, workforce, education, nearly every facet of our community. In preparing for and responding to the COVID-19 virus, I, along with many other community, state, and federal leaders, we've diligently communicated to you that mitigation efforts, including physical distancing, hand washing, respiratory hygiene, and the use of facial coverings, would play a critical role in decreasing the transmission of this disease. And this obviously remains very true today. I, as the mayor of Sioux Falls, am relying and expecting each of you in this community to do your part and utilize these mitigation efforts to help our community fight this disease. We're not powerless, though, in the face of COVID-19 here. As a state, the state has taken a personal responsibility approach and has thus far refrained from broad government mandates in our efforts to manage the virus. And that also remains true today. In addition, since the beginning of the pandemic, our goal in Sioux Falls has been to flatten the curve and ensure that our community's hospitals have the capacity to treat both COVID and non-COVID-19 patients. Let me remind everyone of that. That's been our goal all along, and that goal has not changed. Ensuring healthcare capacity is there for those who may need it is the primary objective in our fight against COVID-19. Due to the responsibility of each of you as residents and business owners, we have seen those initial curve projections flatten tremendously. Today, we are seeing increases in cases across our region. And as with many hospitals across the region, our healthcare systems are experiencing increased but manageable demand. You're going to hear from representatives from Avera and Samford briefly. Communication with both systems remains of key importance to me. Communicate regularly with both the administrators of our large healthcare partners, but also those with their boots on the ground at the clinical level, including the chief medical officers of both organizations. They have been able to share great information on their census data, bed capacity, patient origin data, all important things that we'll be using as we continue to mitigate our fight against COVID-19. But today specifically, I'm going to be asking for enhanced diligence in this community, and specifically on the topic of face coverings. Effective today, the City of Sioux Falls, as an employer, and our 1,300 employees will be required to wear masks in all common areas, all interactions with the public, all areas where distancing simply is not possible. I consider myself the chief executive of one of Sioux Falls' largest employers, and that's a step that I can take to ensure our critical workforce remains healthy while also protecting the residents around them. I'm asking other businesses not only in this city, but in this region, to consider doing similar measures to help slow our spread. You will not see my administration mandating any mask wearing requirements at this time. I will continue to rely on personal decision making, both by individuals, but as well as businesses and employers who have a responsibility as well. I will say, however, that as we move through this current case surge, we each need to do our part to manage COVID-19. I'm also requesting that people that are listening today take care of their own mental health. That continues to be a big challenge in the fight against COVID-19 right now. Make an effort to take care of your physical health, your own mental well-being, control your environmental surroundings, control the information that you're taking in. Despite the current challenges of the pandemic, we have so much to be grateful for still in this community and how resilient we've been to date. And it's vitally important to our overall health and well-being that we remember this. So moving forward, effective today, we will have bi-weekly COVID-19 updates at this time, 1:30 on Mondays. And we'll use that time, whether we have new data to share or not, to answer any questions and talk about how this region and community is doing in our fight against COVID-19. Finally, as a reminder, you can always contact my office directly with any questions, comments, concerns that you have. mayor@siouxfalls.org is a great email address to do that. Next, I'd like to invite up some representatives from our healthcare partners at both Avera and Samford, and I first want to welcome Dave Fleechek. Dave's the president and CEO of Avera McKennan Hospital. Dave?
All right, hey, thanks, Mayor. First, I want to give a shout out to all our healthcare workers. Our healthcare workers across multiple clinical settings, in the nursing homes, in the hospitals, in the clinics. It's a long day in a PPE equipment, and frontline nurses and doctors are working really hard in a very tense and somewhat rewarding time, I would say, as well. So just want to give a shout out to all our healthcare workers. Second, I want to give a shout out to the mayor and the staff, Jill. It's a pleasure doing business with you. The governor and her staff. Only in South Dakota can you call someone up, and in South Dakota they return a call. And I'm just telling you, that's heartwarming, given all of the logistics that we're trying to manage here with testing, making sure we have capacity, ICU, and it's just nice to know that we have a lot of really good people willing to work together, including the other systems, Samford, Monument, Avera. We're in contact every day together to try to maximize our capacity and make sure we're working together through this pandemic. I'd also say we've learned a lot since March. We have learned a lot. At Avera, 60% of the COVID patients are now being taken care of outside Sioux Falls. And I can tell you in March, they all used to come to Sioux Falls. So we've really had a ability to treat patients now in our regional centers, Aberdeen, Mitchell, Yankton, Watertown, Brookings. And so that's something we should lift up as well, is that Avera McKennan is only taking care of 40% of the COVID patients. While we have seen some increases in COVID, we've also seen probably a greater increase in delayed care. And so our hospitals are busy, both of us would say that. But honestly, our ICU, of our COVID patients at Avera McKennan Hospital right now, only 15% of them are COVID. 85% are delayed care or regular routine care or surgeries, sick people. Our ICUs did reach a capacity of 75% this past week, and in the ICUs, only 30% are COVID. So right now, this is all very manageable. We're okay with where we're at right now. What we plan on doing, though, we had a trigger point where we said at 75%, we want to now get ready for the influenza season. So we're going to create 12 new ICU beds, so we thought that would be prudent planning on our part to get ready for the winter. So that is going to go and work, so our employees are working on that right now. Also, we are working on 24 to 34 more surge beds, med-surge beds. And that's something that we're also working on that should have in place through November. So again, this is about being proactive, about managing this disease. But I got to tell you, it does come down to there's no vaccine yet. And so to echo what the mayor said, all of us from our workforce perspective, I have a couple hundred people who are out quarantined. And it was probably happened outside of work. So I would just encourage all of us to continue to wear our mask, continue to wash our hands and social distance. That's how we can at least flatten the curve here. And I think as a workforce perspective, it's really about workforce and keeping people, parents and their kids in school. So just let's do the right thing and continue to wear our mask going forward. So it's been, we're in a really good spot. I think we're pre-planning, we're getting in front of this. And so at this point, It's manageable. So thank you. I'd now like to introduce Dr. Mike Wilde to give a few remarks from Samford.
Thanks, Dave, and thanks to the mayor as well, and good afternoon. So as a representative of Samford, and as I discussed with many of you last week as well, and getting the message out, we also are seeing a lot of patients, which is pretty typical for this time of year, as I've gone back through my own clinical history, but also just working in the role I'm currently in. Typically when schools open up and people are busy, personally, now we're at a time where summer vacations are over, kids are back in school, people maybe prioritize some healthcare decisions at this time of year, and so we traditionally tend to be a little busier this time of year. We of course are also seeing an increased need for COVID care, and as Dave alluded to, and I think makes a good point regarding some delayed care as well. And so certainly seeing more patients at this time currently. We monitor our supplies on a daily basis and are doing fine from that standpoint. And we certainly work with our capacity on a daily basis, not only in Sioux Falls, but in our outlying facilities as well. And the folks out there are doing really nice work in regard to prioritizing care for those patients to get the best care as close to home as possible, where they're the most comfortable. And so would also like to lift up the staff at Samford, both in Sioux Falls and throughout our network, who are working really hard, very tirelessly at this time, really committed to safe, quality patient care. We're in close communication, like I alluded to, with our network facilities to see how they're doing, and then to move patients properly as needs are determined. Work very closely with our partners in the city and partners within Avera. I know just over the weekend there was communication between nursing and physician leaders as to how we're doing and how we can best accommodate patients, and also working very closely with the city in real-time communication and asking how they're doing and vice versa. In terms of caring for COVID patients that are presenting to Samford, we really rely on the expertise of the frontline physicians, nurses, pharmacists, et cetera. We do have weekly calls with our intensive care unit physicians across all of Samford to really share best practices and evolve the practice of COVID. Keeping in mind that this was not recognized until last December, and that those learnings internationally have continued to flow nationally and now locally as well. And so we really tap into our expertise at Samford to share those best practices and learnings. We're also working closely with our network facilities and Sioux Falls facilities to be in real-time communication, really lifting up those best practices for caring for COVID patients. With this, we've been able to evolve to the point where less than 15% of patients needing ICU care are on a ventilator at this time. And that's been a tradition across all of Samford. And what we're seeing currently is about 10 to 15% of patients at Samford tend to be from the Sioux Falls area. Otherwise, we're really seeing this illness, unfortunately, get into our smaller communities as well. And I think that I really want to conclude with what the mayor and Dave alluded to as well, in those infection prevention practices. So as we saw in the spring, this illness was really more common in Sioux Falls, perhaps Rapid City, and a few outlying areas as well. Now it's really ubiquitous across all of our communities. And I think people are, not that they weren't paying attention before, we're really starting to pay more attention. And I think it's important to lift up some of the learnings that we see from the CDC and other experts as well. This is a droplet infection, and so it is spread by contaminated droplets getting on surfaces or directly if you're close enough to someone, and you can pick up the infection. And that's why it's important to, number one, stay home if you're ill, stay 6 feet apart, but then also consider things like where your hands are and common touch surfaces, and that hand hygiene is very important. Masking is a part of that solution as well. And I think there's a lot of focus on masks, but masks are really part of the solution. There's data out there both supporting and saying kind of neutral things about masking. We just don't know yet. And so we really can't make a recommendation outside of what the CDC is recommending, and it really fits in that broad scheme of all the things you need to do to mitigate the spread of this illness. I would just like to conclude with just encouraging people to be really thoughtful about social gatherings and their settings. And from my standpoint, know who you're coming in contact with. And by that I mean, know your family situation and who's at risk. We're certainly seeing more of an active or serious infection from COVID in the setting of folks who are older, obese, other medical conditions as well. So if you're in a housing situation where you're in close contact with people who are at higher risk for hospitalization or more severe illness, I'd highly recommend being very thoughtful about, are you going to go to community gatherings, family gatherings, things like that? What steps are you going to take to not pick up this infection? And then if you're around that loved one that maybe has some medical issues, what are you going to do to prevent that spread? And be very thoughtful in that regard. With that, I'd like to turn it over to Jill for some concluding remarks.
Good afternoon, everyone. After hearing Mayor Paul and our health system leadership speak on this topic, I'd just like to share a little graphical representation of what we've got going on in our community. I hope you're able to see this well enough, but in the upper left-hand corner is our total active cases. And these are people that have the potential to spread the illness in our community. And this, you can see, has been steadily and actually somewhat significantly increasing over the last couple of weeks. Our total new daily cases, which is in the upper right-hand corner here, has been showing a slightly lower rate of increasing, but it's been so volatile. And so you can see we have had days that have been quite significant coupled with, but overall the trending is moving in an upward direction. But really importantly is what we've been talking about in this press conference, and that is hospitalizations, and that's in the lower right corner. And you can see a pretty significant increase. And if you look prior to this time period, you will see that has actually really increased over the last couple of weeks from prior. And you can have access to this anytime, every single day, by going on to siouxfalls.org /COVID-19, and I really invite the public to please do so to stay informed as to how we're doing as a community. So then this next slide provides us with kind of a timeline of where we've been at with COVID, and you can see in this time period here, starting about August, we saw again some volatility, but we are really starting to see an increase across both of our counties, both Minnehaha and Lincoln County. And especially Lincoln County, we're really starting to see some increases that we hadn't seen for quite a while in the early stages of COVID in our community. So that's important as well for us to pay attention to. Bottom line, we've got to reverse these trends. Mitigating the spread of this virus and being able to get a handle on this is really, it's the essence of public health. It's the public's responsibility to do what we need to do to reverse this trend and to mitigate the spread of this virus. You've heard each and every one of us talk about those things that we need to do. We have got to be able to make sure we're physically distancing with each other. We've got to practice good respiratory hygiene. If you are sick, stay home and isolate yourself so that you do not spread this virus or any other infections to other people. And if you're in a situation where you cannot physically distance, you must wear a mask. I really cannot stress that enough right now. Every time I leave home, I'm going to just give you this little example. Every time I leave my office or my home, I make sure I have hand sanitizer, I make sure I have tissue, and I make sure I have my mask. I'm asking each of you to do the same. Until we have a vaccine, this is our best defense, everyone, from being able to make sure that we mitigate the spread of this virus. In addition, we're continuing to work really closely with our partners. We're continuing to increase communications with our health system partners, our other partners across the community. We're continuing to evaluate, as you heard from Mayor Paul, the things that we're doing within our own city to make sure we mitigate the spread of this virus. And we're looking at the other things that we need to make sure we're doing, such as making sure that people who cannot isolate or quarantine effectively in their own dwelling have a place to do so. So those are some of the few things that we're doing right now to really increase our response to this virus. To wrap up my remarks, I'm really asking you all to do your part. It really is upon each of us, each and every one of us, to make sure that I'm protecting you and you are protecting me. That's what we do as a society. That's how we do this work as a public together to mitigate a virus that's in our community and really is threatening us. So with that, I will turn it back over to Mayor Tenhaken. Thank you.
All right, thank you, Jill. I think we'd take any questions at this time for myself or any of our partners that were here. Yes?
I know in August you said sort of the next tier of response you were looking at was 40 hospitalizations per, so obviously that would change depending on capacity. Where we get to another tier of response, I guess what's the, you said the mask mandate isn't off the table, you know, not doing it this time.
Mm-hmm.
Is there any more specifics on when it would be time for that?
Well, I think what's important to remember is a stat that Dr. Wilde shared, and that's 10 to 15% of the COVID inpatients at their organization are from Sioux Falls. So a mask mandate for Sioux Falls, South Dakota, and the 80 square miles here would have a pretty minor impact right now on the surge that they're experiencing. So the message today is really a message to the region more than it is to Sioux Falls, South Dakota, to say we need everybody, whether you're in Brandon or whether you're in Corson or whether you're in Hartford, to be taking the virus as seriously as we are in Sioux Falls. And I think, quite honestly, the mitigation efforts that we've done in Sioux Falls have probably been a little more stringent than you've seen out in the region a little bit, because it hasn't been quite as real. And now we're seeing those cases start to emerge in the region. And that's why they're seeing an uptick in their facilities. So that's my request today, is not just for the residents of the Sioux Falls to take this message to heart, but really, you know, the entire southeast part of the state.
You talked about the new additional capacity. This is probably a question for the health systems. You talked about the new capacity that you're bringing online. Is that between the two health systems, or is that a very specific? And if it's just very specific, is there anything additional in terms of Samford that they're doing as far as expanding capacity?
Yeah, no, so we are, this was part of our original plan. We're open for business with elective surgeries. All our clinics are open. This is just really about, we hit a threshold, so now let's start planning. And it also is the flu season, so we just want to make sure we prepare our staff and our facility to manage that as well. But that's where we're at right now. Now that's fluid, so it could keep changing as we move forward.
So the question specifically was asked of Samford if we're doing anything from a capacity standpoint, and thanks for reminding me, as I had left that out of my presentation. So we're always looking at expanding, getting out to closer to people and things of that nature. As this pandemic started, we changed those priorities just a bit and did absolutely prioritize 16 additional what we call mixed use beds, so they can be both medical, surgical, or intensive care unit, and those are going to be in our heart hospital. As I thanked our healthcare workers, I'm remiss if I don't thank other people that do a lot at our facility, and that's our facilities folks, our maintenance folks, our construction, environmental services, food services, and if I leave anyone out, I apologize, but those rooms are being readied rapidly, and within the next couple of weeks we'll be ready as well. So yes, we have expanded that capacity.
Sir, when you say the 10 to 15% statistic of Samford patients being from Sioux Falls, is that a similar situation to what the very CEO said, where your best practices have lowered that number from the start of the pandemic, where the majority of those patients being treated in Sioux Falls?
As I heard the question, I think my numbers, although they were close, they could be confusing. So of the patients that are coming in with COVID, less than 15% are requiring a ventilator. And then 10 to 15% of the patients are from the Sioux Falls area. And I saw Mr. Fleechek nodding his head, so I assume that's similar. they're at 20, is what he just said. So thanks, Steve.
You both mentioned staffing, and I think you mentioned a specific number. You have 200 on quarantine. Can you talk about capacity and some of the things you've had to do in terms of staffing? Because certainly staff has been out, and you need staff as you increase capacity.
So staffing is the question?
Yes.
Yeah, so that is a challenge for all of us. I think the next 12 beds we're going to be okay, and the next 24 beds will be okay. But we do have to continue to not have people get quarantined. I have a couple hundred people that are quarantined right now, aren't sick, but are quarantined because they were in close contact with someone. And so that's just something, as a workforce, all of us, businesses, we should understand that and just realize by keeping a workforce, it is the proper hygiene and masking. So at this point in time, it's manageable. We feel confident that it's manageable. Again, our facilities outside Sioux Falls, like Yankton, Mitchell, Aberdeen, I'm sure Worthington, they're really stepping up and doing their part in helping take care of COVID, which was not the case in the early days. So we've been able to spread that out.
I want to chime in with one thought on that. Very real example, within the city of Sioux Falls. As an employer, we had a team of 5 people in a meeting a couple weeks ago. One of those people tested positive for COVID. No one in the room was wearing a mask. I now have an entire department. It's a 6-person department, 5 people out, quarantined. And so wearing masks is as much of a workforce issue as it is a health and public health issue. I was at a restaurant recently, 4 people working behind the counter, none of them having masks. If one of those people has COVID, that person just lost his whole front of house staff as a result. So that's why this is very important from a workforce standpoint as well. I know public health is obviously very important, is our primary goal, but businesses have to really be thinking about the ramifications of workforce. And it really hit home for us and me as an employer when we had that quarantine situation just a few weeks ago, which is why we moved to a situation today where we're just going to require masks all the time within the city of Sioux Falls for our employees. Other questions today? Todd?
Okay, so you have a news conference today, you have a news conference next week or the week after. Tell people, okay, please wear a mask, please wear a mask. Is there going to be any kind of public campaign? Are we going to see anything else in the media, PSAs, billboards, something to try to drive home that people in Sioux Falls and the region, please wear your mask when you go out?
Yeah, you will be seeing enhanced messaging out of my office and out of the city on this. And so what that looks like yet, we'd like to talk to our media partners. I don't know if anybody knows any media people in here, but if any media would like to partner with us on some PSAs, we sure would be open to that. But it is enhanced messaging that you'll see out of the mayor's office starting immediately.
So you're talking about working with, this message is for the region, not just Sioux Falls. So how are you working with the region to spread this message? You're talking to the mayors, are they going to come out with some messaging too, or are they going to come out with some statements?
Well, I haven't talked with a lot of the MSA mayors. I have talked with county commissioners. I just had a call with County Commissioner Chair Gene Bender this morning on this topic. It sounds like they're going to be addressing some similar things potentially at their commission meeting tomorrow. What I have found, though, is within this MSA and within this part of the state, there's a very strong collegial cohort of mayors. And when one of us acts, we all kind of act together. And so I would very much expect them to embrace this message because just like it's a workforce thing here, it's a workforce challenge for them as well in their communities, and it's a public health challenge for them in their communities as well. So no one's unique.
If we don't continue to see numbers go down, could there be more or a return of restrictions from the city at some point?
Yeah, and I will say this, I'm going to be like Brett Favre in retirement and say I'm 99.9% sure I'm going to retire. And he still has never said he's fully retired. But the point of that being, there's always tools that we have at our disposal to use. Tools that we used in April and May to help flatten the curve. But at this time, it'd be tough for me to say I'd see a situation where we return to business restrictions in this community. Because I think there's a lot of things we've learned over the last 6 months of better ways to flatten the curve and control the virus than putting a hammer on top of business.
We've heard a lot about freedom from the governor, freedom to wear a mask, not wear a mask. Has the message of
I think, the question was, has the message of responsibility got lost? I would say it's not lost, but there's an incredible amount of fatigue right now, an incredible amount of anger and frustration with people and mistrust of government officials, of media, of everybody. And so it's very hard for people to know what are they supposed to do. And so the best thing that I can continue to tell people is you need to do what's best for your situation. As an example, yesterday, I never missed church on Sunday, man. I go to church regularly. I decided to worship from home yesterday. I knew there'd be people in our church. I'm like, they don't need 5 more bodies in our church today. We can do it from home. That was a decision we made for our family. And there was 30 other people worshiping online with me, and I saw their names, and I know them because they're members of my church, and they were older people. And they made that decision for them. So personal responsibility is still, I think, the number one thing we have going for us right now that people need to continue to take seriously. Okay, well, thank you. You can mark your calendars every other week for this at 1:30, and that doesn't preclude us from having updates more often depending on what the data continues to tell us. So I want to, again, just thank both of our healthcare partners here. And I also want to say one last thing about our VA hospital in Sioux Falls, which also has not been immune to what's happening with COVID. And they're doing a fantastic job there caring for our vets. So thank you to them also. So have a good